So managing these mobile devices. Now they're good 5 steps. And number 1 is decide whether you're actually going to allow these devices on your network and what you're going to allow them to access. Are you going to allow them to access your EHR? And they're going to be able to see patient information. Are you going to allow them to access your calendar? Calendar is going to have patient names on it. That sometimes can have PHI included in it. So you want to make sure that you've clearly decided and notated what information you're going to allow on these devices. Access. So what level of access are you going to give to people? How are they going to access it? Are we going through a VPN? Are we accessing through HTTPS? How are they going to get that information? How are we making sure that's protected? Identify. So, look and say, okay, we want to say, all right, identify what devices we're going to allow, identify what information we're going to let go through. It's very important. I mean, this is part of the whole, documentation and when it comes to your security policies and procedures. And as you see, develop, document, and implement. You want to develop those policies, you want to document everything that we've been talking about, and then implement it. And really, you want to be able to push that out and say, okay, this is how we're going to do this. This is what our password policy is. This is what we're going to do if you do not follow our password policy. You could be retrained if we find, second time that the password protection is off your phone and you're using your device to access our network. You are going to be suspended for a week. Make sure those policies are there. They're consistently enforced, and really, this is a very important part. And training. Train your people. I mean, they're your front line, and they're also your weakest line when it comes to enforcing HIPAA. They come in contact with so much information. They also need information, and it's really their responsibility to help you protect your patients and help protect that information and keep it within your practice. So train. That's annual training, possibly even quarterly reminders to just say, hey, this is what's going on. Little friendly things saying, when was the last time you changed your passwords, not only for the practice, but maybe your personal passwords. People get very complacent and very lax about these things.